I can try. Okay, sorry. So I'll start from the beginning. Okay.
He's back.
There he is, and he's happy looking. Look at the tail
Man, I know. Sorry.
Very brave boy.
So we just want to recheck this one numbers. I was like, this is weird that this number is so high. Unless this is like associated. But so this is our left. Us on our side. Our left side down. Liver, spleen, big yucky friend that I don't like. I don't know what kind of friend. And I say that very facetiously, but just a mass. It's a mass effect. Okay. So it's displacing intestines downward. It's kind of pushing the colon down a little bit because this is the colon where our poopy comes out.
So that's why he's not pooping.
Well, I think he's not pooping because he's not eating as well. All right. If you don't eat it, then you're
he's
not.
eating like a horse because we had to swap over to wet food.
Oh, that's right. Okay. Well,
But
yeah,
he's
I
loving
can. Yeah, I mean, it make it slower to get out for sure. So that's the left side down. This is the right side down. So we try to get a full picture, so just make sure we're not missing anything. Kidneys are in this region, so that is one kidney there. But we got a lot of superimposition of other things. Our stomach is up here. Obviously, it's empty, but this is taking up so much space that it's causing
That whole circle?
that whole circle is a mass.
Probably that's all his weight. He's not overweight this whole entire time.
So this whole time he wasn't overweight. We were dieting him.
Poor guy. And then we did do one picture of the chest, just more because I wanted to make sure we didn't see anything else going on there. I don't see any obvious metastatic disease right now. Bless you. So usually when we're looking for scary cancer in the chest, we look for either a snow globe pattern or cannonball lesions. Okay, which is probably we see more on TV, right? They're like, oh, see all the cannonballs.
Yeah.
I don't see that here. I just see, I see some end on blood vessels and the bronchi, but I don't see any scariness that way. Granted, things can always change in time, okay, but I don't see anything obvious that way here yet. So the hard part is I don't know exactly what organ that is associated with. I've definitely seen, I've seen crazy things, really scary things, and really not so scary things. I've definitely seen basically a necrotic lipoma in the abdomen that we had to surgically remove when I was in vet school. And it took up space. It was pretty good size. It was yay big. I don't know if that's associated with an organ or if that's associated with nothing. We can't really know that without doing surgery to remove stuff, right? I still don't think he's at the point right now that we have to do that right this moment, okay? I think that's in our favor, right? Because I know everything's expensive. I don't think he has to have it done right this moment, so we can at least do a little more planning, and you guys can at least source out.
He has no blockages?
Not that I'm seeing on here, no. Not obvious. I can't say that for sure isn't blocking, but if he's eating and he's not straining to poop, then I'm not as worried.
We haven't seen him poop in days.
But he's not trying to go and unable to go, right?
He's not trying to go, no.
Okay, so then I'm not as worried that way. Okay. If he's trying to go but can't go, then I'm more worried. Okay.
Is there any way to test if that's cancerous?
Not without removing it and sending it off.
Biopsy,
yeah, sending it off for, yeah.
How did my other vet not see this?
You can't always see it on exam, honestly. Sometimes they start small, right? They don't get this big overnight. So it takes time. It takes time to get there. How
long do you think he's had that from the size?
It honestly depends on what kind of mass it is. Some things can grow for months, years. My father-in-law just had a mass removed from his brain, and it had been there for 10 years, I think, before it started showing signs. So, it's completely different. I know it's human medicine, but, it really depends on
the only human medicine I've ever given him his whole entire life is Benadryl and then Tramadol yesterday. Okay. That was it. Oh, and clindamycin.
Okay.
Does he need to still continue the clindamycin?
I would do Clinda since he had that history up here. I was debating sending him home the other antibiotic as well. I don't want to give him more problems, but, because he had the fever. But I do think...
Is the fever gone? Or do you know why he had a fever?
It could still be related from the infection he had in his mouth versus...
Did you see it? Is there still an infection? Look, but he never had a follow-up.
I know, but if it's the root, it's still going to be there.
You could see it. It was. You could see it here.
Yeah.
It was so nasty. You could see it.
But I'm saying it'll be involved inside the root of the tooth. So
his face was.
It's kind of like when you treat an antibiotic with an antibiotic, it'll mostly be treated, but it's not going to fully go away. It's one of those until you pull until you So.
Is he, with his age, being put under for surgery?
Never without risk.
Hmm?
It's never without risk. Even like your totally normal, healthy dog has risks of issues. So it's never without risk, but you kind of have to weigh your risks
What
and
are,
benefits, right?
what are the percentages with his age? How,
Mm,
how
mm,
often have you seen?
So I primarily work in low-cost spay-neuter world. So I have, we do our really quick surgeries and we have fairly good luck. But I mean, I don't think it'd be crazy high. I think as long as there's blood work and everything else. I mean, that's more where you get to more issues. Is like if your blood work shows anything scary, which I was looking at his chemistry, and his chemistry isn't terrible. But one value I was like, is this truly this high or is it not this high? That's why they stole more blood because they're like the sample wasn't as good as we thought it was. So they're just redoing it just to be on the safe side. So it's not going to cost you anything for us to redo it. Okay. On his white blood cell or red blood cell count, it does look like he's got like a little bit of a. Let me make sure I'm not missing him. Or confusing them, a regenerative anemia going on. So like his blood, no, it's not true. Sorry, I'm confusing patients. I apologize. No, his red blood cell count was high. So more like dehydration type size.
Okay.
When he finally peed for the first time earlier outside.
Super concentrated.
Oh yeah.
Yeah. Let me see if I can pull. Nope.
And he has been decided to be outside in this house.
And he's been wanting to be outside for the past 5 days in this heat.
Yes, my dog wants to do that too. I'm like, why? Why are you trying to kill yourself with heat stroke? We don't
No,
know.
is that something you didn't want to know?
Oh, you're fine. Sorry, I'm pulling up his blood works.
Oh, okay. Is that okay?
Yeah.
I'm not. Yeah, this is just for my mom.
So yeah, our hematocrit is on the higher end side, okay, which is our PC side. So that's this quantity of red blood cells and blood volume. So when you're dehydrated, you have like less fluid, right? But you have more red blood cells in that same fluid. So that's why that number is higher.
Okay.
So reticulocytes are baby red blood cells. They're like the ones that replace your adults as they wear out or whatever. So like when you're anemic, you should have a higher number of reticulocytes trying to replace that. So his reticulocyte is just on the low side. I'm not sure why it's low, but it's on the lower side. These are types of white blood cells. Lymphocytes are a little on the lower side. Monocytes are a little on the higher side. So monocytes more tell us inflammation. Lymphocytes are more like, again, an infection-y type thing, which his might be low normal because he's had that chronic infection. Okay, so he's
bad.
His body's been treating it, but
It was like this.
they have to regenerate and so
It was like 2 baseballs under his eyes.
I believe it. Yeah, poor guy. Total protein and globulins. So globulin and albumin are types of protein. So our total protein is high because our globulin is high, but globulin is like more with chronic infection, chronic inflammation, sometimes cancer. I'm not going to say it's because of cancer, but so he has reasoning for his globulin to be high. He's had the infection with his teeth. He's got
He had an ear infection.
Yeah. I don't feel like that usually as systemic with the globulins, but because when you have the bacteria going, that's going through your blood vessels too, right? Ear infection is more like environment, so I don't feel like that's as quite systemic. That makes sense. Okay. This is the one I was like, why is this number? I don't like that. It's bilirubin. So that's why they're redoing it because I was like, he's not yellow. Like usually when our bilirubin, not always, but when our bilirubin is high, usually like we're very icteric. We're very yellow because we got like a gallbladder blockage going on.
Type
Yes, exactly. So we're just gonna recheck that and make sure. Because could the mass be associated with something to go there? Possibly, but placement of it where I'm seeing it on the x-ray, it's your liver first, then your spleen, like up to the side. Not that it can't be associated, but like I see a mark, demarcation between the spleen and the mass. It's not like it's going past the spleen. So that's why I'm like, where is this? But it's also 2D image, not 3D. So theoretically it could still be associated, it's just not as obviously to me on the x-ray. Okay. So could the mass theoretically be causing this? Possibly, but I can't say for sure. But the rest of it looks okay. So that being said, like his kidney values are beautiful, his liver values are otherwise beautiful. So those are good signs for like no underlying issues with like if he were to get surgery. Okay.
Heart.
These don't do heart, like that's not necessarily your heart stuff, but his heart sounded okay to me on exam, and his pulse was okay too, like the quality of his pulse. I didn't hear an obvious murmur. He had a good pulse quality. He didn't have like a arrhythmia when I was listening to him. So those are all good signs too. We had that one image, it's just a lateral, but just we have the one image of the heart, and it didn't look scary big to me either. So I think that's a good sign for him. Again, there's still always risks. You can't take the risks away, like I said. Yeah. So, but ultimately, to make him more comfortable, and like, there's also a very good chance wherever he goes, they open him up and they're like, hey, they probably would recommend an ultrasound first, like a true, I was gonna say professional, that's not the right word. Like with someone that's specialist is what I'm trying to say. Thank you. Granted, we have someone that will come and do them mobily, and he's not the one that interprets them, but he takes the images and like sends it off, and then they interpret it for us. So that's one option. Versus, there's also like an internal medicine doc named Dr. Traub, and she will also go to the various clinics. I know she's got a pretty long wait list though. So Dr. Lederberg is more likely to be whomever you talk to or take him to for other stuff. He's more likely to be the one that would probably scan him, honestly. He's wonderful. They can give you a better idea of what it's clearly associated with. Still a chance you might not get that answer, but more likely to with an ultrasound. Problem is, like, it's so big that's probably where we might run into more issues too. It's kind of like, okay, I realize you guys probably haven't had kids, but like when they do ultrasounds for babies and stuff, when they get to a certain point, they're so big in your belly, they're like, I can't really tell this because it's so big now. Like, so sometimes that can skew what you're getting. Okay.
An obstruction because it's so big you can't see.
You can't always like see like the endpoints because it's so space occupying that you just can't see where it's associated with. And so that's where sometimes that can be more of an issue, but still an ultrasound will probably be recommended before you do surgery. And then whomever cuts them and does surgery, there's still a chance, depending on what they find on ultrasound, etc. I mean, some people will still opt to cut them blindly, but I feel like in this day and age, it's more likely that they'd still say, hey, I'd rather have an ultrasound first. But that being said, they would still be doing quote unquote an exploratory surgery because that's what you're doing. You're trying to see what it's associated with and ideally remove it. There's still a chance they would go in and be like, hey, it's associated with this. We may or may not be able to remove it. And they might give you a call when he's on the table, and that's also a possibility. Okay, so those are all kind of things that like mentally kind of have to just prepare yourself for, I guess, because if it's something that they feel like they can't surgically remove, your options are either to close them and just let him live out his best days, or make a decision and not wake him up. And that's the other hard part. It's a lot, I know. It's a very loaded thing, okay?
How much pain do you think he's in?
I think he's uncomfortable right now, but like his heart rate isn't like elevated. So I don't think he's, he definitely could be worse. I've definitely seen much more painful animals. I do think when he puts pressure on that, it's ouchy, right? If we put a pressure on there and we pick him up the wrong way, it hurts.
Or when he moves in the wrong, like he decides to do it like weird moves. So
sure.
That's why it actually hurts him.
Probably when he like twists and stuff a certain way. Sure, yeah. Which is why I always say let's do some gabapentin for some pain relief. We'll do some anti-nausea and some fluids to help with hydration status, since his red blood cell count is a little bit on the higher end side. I would rather make him more hydrated. And then we'll send him the antibiotic, possibly two. Because I don't want to like decrease his appetite by any means. So obviously an antibiotic side effect, just like us, GI upset, right? Vomiting, diarrhea. So I always give him with food. Okay, those are your main side effects.
Did you say he was anemic?
No, he's not anemic. Opposite.
Oh.
Yeah.
Oh, like almost type 1? Like almost needing insulin?
So anemia is number of red blood cells. It's not diabetes. So that's glucose.
You're
fine. You're good.
Oh, Lord.
You're okay. I said anemia, but I was like, no, I'm confusing him with a different dog.
Yeah,
so
okay.
You're fine. I was like, no, he's the opposite. He's he's high normal. He's not like scary high, but he's high normal. I was worried
about diabetes.
Okay. No, his glucose is fine.
Okay.
Yeah, his glucose is fine.
Because I just thought he was heavyset. But this thing is recent.
Okay.
This isn't something that...
I think he's been good at hiding it for a while, and he probably didn't even know it was there either, right? But it's not until it gets so big that it's bothering you that you notice things. Like, same thing with us. I have a friend who, she's got ovarian cancer, and she didn't know it by the time they discovered it. Like, her ovaries were this big, and they're supposed to be this big. So, oh man.
Took the Navy 4 years to find that. Ocular monitor.
Jesus.
Yeah. I didn't know.
Yeah.
I just can't see out of that eye.
Sorry.
Never thought about it. So, same thing.
It looks like it's something like over the years. Because normally, like, we take him to the annual exam, and they have to check under in a pop, and then they could not feel it for like at least in the past 4 years.
Yeah. I mean, a lot of times I feel like they can sit slow, and then when they get to a point, they just, it's kind of like an exponential thing, like once you get so much vasculature associated with something, like initially when something starts growing, there's not that many blood vessels associated, okay? As it gets bigger, it needs more blood supply because it's going to crave more nutrients to like steal things, right? And so the more blood vessels you get, the more rapidly things are going to grow. Does that make sense?
Yeah.
Kind of, yeah. So I feel like, I don't think anyone necessarily missed anything in the past. I just think it's how things have progressed, and all of a sudden now it's this big thing. And it definitely didn't grow overnight. Okay, it's taken time to get there.
It took a week, maybe, for us to see it and feel it.
Yeah, and I mean, and also I think where it's centrally located, it would have been hard to feel anyway. Like a lot of times masses, on this image, it's more to the left side. Which is where So, just trying to see. So that's the tail of the spleen there.
And that is
that's the kidney there.
pelvis?
Yeah, that's his pelvis.
Okay, pelvis.
I mean, maybe it's associated with the kidney. I don't know, but I can't see demarcations of. I can't see the obvious kidney on this side, but it's also weird that he would have a mass that big associated with his kidney, and his kidney that is be normal too. I will say that would be unusual. So,
would it be safe to say there could be a possibility that it's just a random mass in that spot?
It is possible. We just don't know what it's associated with. I don't know if it's like connective tissue or an organ or something else.
Okay, because he has these fatty things
all
all over him.
I don't
see how he growls.
I know.
It's not a mean growl.
No, he's protecting himself. He's
don't
guarding.
touch me.
Yeah, he's guarding himself. Because my older girl, she's got arthritis, but if she's like resting like this and sleepy, if I like catch her off guard, she would never do anything to me.
He would
consciously.
never.
Yeah, consciously she would never. But she definitely growled at me one time, and I was like, "I'm sorry, I didn't mean to upset you."
Yeah.
So, it's definitely possible. But we just don't know, unfortunately, without like more diagnostics, which is of course what costs money, right? That's what always adds more. And I also don't have the skills to give you more information that way. Like I have to call someone else in to do that. And I don't want to just say I don't think he's at the point that we need to do surgery right this moment. Like I definitely think he would benefit from having that taken out if it's possible to take that out. But I don't think it's something we need to do like right this instant right here.
Is it a possibility if he does need to have surgery to do 2 surgeries at one time? He needs his teeth pulled.
Oh yeah, for sure.
Okay.
Which is even more why I would recommend he do that at a primary care clinic.
Because I was already scared to do that.
Yeah. No, usually, definitely. So the hardest part is length. You don't want them under anesthesia for a crazy long period of time if you can avoid it, right? And obviously if he's stable enough. So.
Okay. He has weird breathing issues. I don't know if it's an issue or if it's just him. I'm gonna pause this so my mom can listen.
Sure.
So I'm gonna pause this and I'm gonna play the video of him breathing this morning.